Let's talk about this bone. Can you identify this bone? Let me give you a bit closer look and few seconds to think. If you are able to identify this bone, then that's great. But if you are confused either it's radius or ulna, then let me tell you this is the radius bone of the forearm and this one is the ulna. As we know, these two are the long bones. So we can study them under three different divisions: proximal end, distal end, and this intervening shaft. So, how to identify which one is ulna and which one is radius? If we talk about the proximal end of the radius, it has got disc-like circumferential head with constricted neck and medially placed radial tuberosity. But in proximal end of the ulna, we have very peculiar beak-like process which is called as the olecranon process. Inferior to that is this coronoid process, and in between two processes we have got this trochlear notch which fits with the trochlea of humerus. And there is a radial notch superiorly or proximally in this ulnar bone, whereas in distal end of the radius we have got this ulnar notch. Now distal end of this radius is slightly quadrangular. We can see here with this lateral styloid process, while the distal end which is known as the head of the ulna. Can you answer me in the comments below why distal end of this ulna is called as head? So this is not completely circumferential but has got this posteromedial styloid process. So this is how the ulna and radius can be differentiated. We hope your confusion has been cleared. In this video, we will talk about the radius in details. And in our next video, we will talk about this ulna bone in detail. So do follow our videos. Now let us talk about the bony features and side determination of this bone. Before determining the side of this bone, as it is a long bone, it has got proximal in, distal in, and has got intervening shaft. So we will learn about the features at first that will make us more easier to identify the side. So in the proximal end of the radius, we can see it has got head, neck, and tuberosity. Talking about the head, it is disc-like in shape and has got concave depression which articulates with the capitulum of humerus. And this radial head, the circumference is smooth and is also articular because medially it articulates with the radial notch in the ulna proximally, whereas also it is enclosed by the annular ligament to form the superior radio-ulnar joint. Below to that, this constricted lower portion is called as neck, and in the medial margin of the neck, we have got this radial tuberosity. So, radial tuberosity is placed medially, whose anterior portion is smooth, while the posterior portion of the radial tuberosity is rough. We can see here. Now, if we talk about the shaft of the radius, it has got three borders and three surfaces: anterior border, interosseous or medial border, and posterior border. So tracing the anterior border, we can trace it from the anterior margin of the radial tuberosity. Upper half of the anterior border is oblique and is also called as the anterior oblique line, and in the lower half it runs vertically downward and laterally to the distal end of the radius. This is the anterior border of the radius. Similarly, if we talk about the medial or interosseous border, it begins from the lower end of this radial tuberosity medially as a sharp ridge, which is also called as interosseous border, and can be traced up to the posterior surface of this ulnar notch in the distal end of this radius. Similarly, if we have to trace this posterior border, we can trace it from the posterior margin of this radial tuberosity, which is also called as the posterior oblique line in the upper half, and in the lower portion it runs vertically downward in the mid portion of the shaft to the posterior distal end. So this is the posterior border. So the surface between the posterior border and anterior border is called as the lateral surface. This is the lateral surface, which is more convex in the middle portion, and we have got this anterior surface in between the anterior border and interosseous border or medial border, and the surface between this medial border and posterior border is called as the posterior surface. So three surfaces and three border: anterior border, interosseous border, posterior border, anterior surface, lateral surface, and posterior surface. This is about the shaft of the radius. Now if we talk about the distal end of the radius, it has got five different surfaces: anterior surface, posterior surface, lateral surface, medial surface, and inferior surface. Anteriorly, it is smooth and expanded. Posteriorly, it has got the central prominent projection which is called as the dorsal tubercle of the radius or Lister's tubercle. Medial to it, it has got two groups, and lateral to it also it has got two different groups for the passage of tendons. We will talk about that in a bit. And then laterally, it has got the pen-like projection which is called as the styloid process of the radius. And in the medial surface, we have got this ulnar notch which fits in the distal ulna. And then we have got this inferior surface. In the inferior surface, laterally just beneath this styloid process, we have got the triangular area or surface for the attachment of scaphoid bone, and this medial surface, which is quadrangular, is for the articulation with the lunate bone forming the wrist joint. So this is about the inferior surface. Anterior surface, medial surface, lateral surface, and posterior surface of the radius bone. This is about the distal end. As we learned about the different bony features of this radius bone, what could be the correct anatomical position of this bone now? So proximally, this is the radial disc-like head. Radial tuberosity should be placed medially, has anterior smooth, and this anterior oblique line or anterior border with this interosseous sharp border medially. And in the distal end, we have got this anterior smooth surface with lateral styloid process and medial ulnar notch. And posteriorly, we have got this dorsal tubercle of the radius or listus tubercle. So the correct anatomical position, and what is the side determination of this bone then? This is the radius bone of the left hand. So if this is placed like this, facing towards you, this is the hand of someone facing towards you, then can you identify again? Styloid process facing laterally in the distal end. Anterior portion is smooth. We have got this medial ulnar notch. Then we have got this medial radial tuberosity in this proximal end. And we have got this anterior oblique line and this medial interosseous border. So this is of the left forearm. Now, can you tell me this radius bone is of which forearm then? Which side of the forearm? So we have this radius bone of right forearm and this is the radius bone of left forearm. To study the muscular attachments, we will use this right radius of the forearm. Suppose this is the radius bone of a person facing with the right hand in anatomical position towards you. So this is the proximal end, distal end, and the shaft. So what are the muscular attachments? We can learn the muscular attachments in insertion and origin wise or as in the surface wise. But let us make it easier through insertion and origin wise. So there are total of 5 insertions in the radius bone and 4 origins from the radius bone. First of all, we will see from the proximal end. In the medial, this radial tuberosity, we have the insertion of biceps brachii, and lateral to that, in the lateral surface, in the upper 1/3 portion, we have got the attachment or insertion of supinator muscle that is originating from the ulna, which extends anteriorly to posteriorly as well. And in the middle portion of the maximum convexity of the lateral surface, we have got the insertion of pronator teres, and in the lower or distal end, we have the attachment of pronator quadratus with lateral attachment of the extensor retinaculum as well. So these are the 4 attachment, and there is the 5th attachment or insertion of another muscle that is called brachioradialis above this styloid process. So this is about the insertion. Now talking about the 4 origins of the muscles. So we have the origin of flexor digitorum superficialis from this anterior oblique line, and then from this upper anterior surface, upper half of the anterior surface, we have the origin of flexor pollicis longus. Similarly, the next 2 origins are from this posterior surface. So in the upper half of the posterior surface, there originates the abductor pollicis longus, and below to that there is the origination of extensor pollicis brevis muscle. This is the origin 4 muscles and the insertion 5 muscles. And also posteriorly, the insertion of biceps brachii, supinator, and pronator teres can be observed. Now, if we talk about the posterior distal end of the radius, it has got different grooves which are related to the different tendons of muscles of the forearm, which allow the passage of tendons through these ridges and the grooves. So, from medial to lateral, let us see. From the medialmost groove, which is shallow, it is related to the extensor digitorum and extensor indicis tendon. Just medial to this dorsal tubercle, there is the relation of extensor pollicis longus tendon, and then just lateral to the dorsal tubercle, we have the relation of extensor carpi radialis brevis, then we have the relation to extensor carpi radialis longus, and then extensor pollicis brevis and abductor pollicis longus most laterally. So this is about the relation of tendons in the dorsal end. If we talk about the anterior surface, we palpate the radial pulse against this anterior surface of the distal end of the radius bone. If you are at the end of this video, we hope that this has been very helpful and efficient in your revision. For more such updates, do not forget to subscribe MedVids Nepal, and if you loved this video, do like the video and share it with your friends as well. See you again in the next video. Bye bye.